They poisoned an entire city, and nobody knew. Welcome to When Time Stood Still. What you're about to see isn't conspiracy theory, it's declassified fact. For decades, the United States government experimented on its own citizens, without consent, without warning, without mercy. They sprayed bacteria over cities. They injected plutonium into pregnant women. They gave soldiers LSD and watched them lose their minds. They sterilized thousands without telling them. They let men die from diseases they could have cured. And they lied about all of it. This is the story they tried to bury. These are the photos they never wanted you to see. OperationSeaSpray. September 1950, San Francisco. While the city slept, a U.S. Navy ship sailed into the bay. On deck, sailors in gas masks operated strange spraying equipment. They were releasing Sriracha marcensis, a bacteria, a bioweapon. The cloud drifted over the city, through windows, down streets, into lungs. 800,000 people breathed it. Families, children, the elderly. None of them knew. The Navy was testing biological warfare on American citizens, on their own soil. Within days, people started getting sick. Mysterious infections. Stanford Hospital was overwhelmed. Doctors had never seen anything like it. Edward Nevin, 75 years old, died. Heart infection, Sriracha marcensis. The Navy knew. They said nothing. For 25 years, they lied, denied it happened, called it conspiracy theory. Then, in 1977, the documents were declassified. The truth came out. The Navy had sprayed bacteria over San Francisco, over other cities too, Minneapolis, St. Louis, Key West. They tested biological weapons on Americans, and when people died, they called it acceptable losses. No one was punished. No one went to jail. The victims, they got nothing. But that was just the beginning. From the 1920s to the 1970s, America had a eugenics program, forced sterilization. 60,000 people, maybe more. The feeble-minded, the poor, the disabled, Native Americans, African Americans, anyone the state decided shouldn't reproduce. They didn't ask permission. They lied. Women went in for appendicitis, woke up, sterilized. Girls told it was a routine procedure. It wasn't. The paperwork was fake, consent forms that didn't explain what was really happening. 32 states had these programs, institutions, hospitals. It was legal, supported by the Supreme Court. The Nazis copied it. American eugenics became the model for their program. We taught them how. After World War II, when the world saw what eugenics led to, did America stop? No. It continued into the 1970s, decades after Nuremberg, decades after we knew better. Finally, survivors started speaking out, demanding apologies, compensation. Some states apologized, gave small payments. Others, nothing. The victims are mostly gone now. The program, barely taught in schools, almost forgotten. But it happened, here in America. Tuskegee Syphilis Study, 1932, Tuskegee, Alabama. The U.S. Public Health Service told 600 African American men they were getting free health care, special treatment for bad blood. They weren't. 399 of them had syphilis. The doctors knew, the men didn't. For 40 years, researchers watched them die, took notes, documented the progression of untreated syphilis. In 1947, penicillin became available, a cure, simple, effective. The doctors didn't give it to them. They wanted to see what happens when syphilis goes untreated, to completion, to death. The men trusted the doctors, brought their families to the clinic. The wives got infected. The children were born with it. 40 years, 400 men used as lab rats, dozens dead, families destroyed. And the government paid for it, published papers about it. No one stopped it. In 1972, a whistleblower leaked the story. The press exploded. Congress investigated. The study ended. Not because the government had a conscience, because they got caught. The survivors sued, won a settlement, but the money couldn't give them back their lives, their health, their dignity. In 1997, President Clinton apologized, 55 years too late. The last survivor died in 2004. He was 96. He spent his entire adult life as an experiment. Radiation experiments. The atomic age brought new opportunities for science, for weapons, and for experiments. From 1944 to 1974, the U.S. government conducted radiation experiments on Americans. Pregnant women were given radioactive pills, told they were vitamins for healthy babies. The babies were born with defects. The mothers developed cancer. The government tracked them, studied them, said nothing. Prisoners had their testicles irradiated in exchange for small payments. They weren't told about the cancer risk, the permanent damage, the sterility. Hospital patients were injected with plutonium, without consent, without knowledge. Eb Cade was in a car accident, broken leg. While he was in the hospital, doctors injected him with plutonium. Then they pulled out 15 of his teeth, not for medical reasons, to study how plutonium concentrated in bone. Thousands of people, hundreds of experiments, across the country. The government knew it was wrong. The experiments were classified, hidden. The victims were called human products, numbered, dehumanized. In the 1990s, journalists uncovered the files. President Clinton formed an advisory committee. The evidence was overwhelming. Apologies were issued, some compensation paid, but many victims were already dead. Many never knew what was done to them. The last of them are dying now, taking their stories with them. MKUltra. 1953, the CIA launched a program, codename MKUltra. Goal, mind control. Method, whatever it takes. They used LSD, electroshock, sensory deprivation, torture, on Americans, without their knowledge. CIA safe houses were set up, prostitutes were hired. They drugged clients with LSD. The CIA watched through mirrors, took notes. Psychiatric patients were given massive doses, strapped to beds, forced to listen to recordings for days. Doctors tried to erase their personalities, reprogram them. It didn't work. It just destroyed them. Frank Olson was a CIA scientist. His colleagues dosed his drink with LSD as a prank. 9 days later, he went through a hotel window, 10th floor. The CIA called it suicide. His family suspected murder. Decades later, evidence suggested they were right. In 1973, CIA Director Helms ordered all MKUltra files destroyed. Most were shredded, the evidence gone. But some survived, enough to prove it happened. In 1977, Senate hearings exposed the program. The CIA admitted it, barely. Victims came forward. Most didn't even know they'd been experimented on. The CIA had destroyed the records. There was no proof, no compensation. To this day, we don't know how many people were in MKUltra. Thousands, certainly, maybe more. The CIA says the program ended. They promise they stopped. Do you believe them? LSD on soldiers. The military wanted to know what LSD does to soldiers, so they tested it on their own troops. Thousands of young men told they were testing gas masks, protective equipment, chemical defense. They were given LSD, massive doses. Some were told, most weren't. The military filmed them, documented the effects. Soldiers unable to follow orders, unable to stand, unable to think. Some never recovered. Permanent psychological damage, PTSD, flashbacks for decades.
At Edgewood Arsenal in Maryland, 7,000 soldiers were used in chemical experiments, LSD, nerve agents, incapacitating drugs. They were promised it was safe, patriotic, necessary. It was none of those things. The experiments were classified. The soldiers were sworn to secrecy. When they developed health problems, the VA denied their claims. No evidence of exposure. The evidence was classified. In 1975, as some files were declassified, veterans started coming forward, demanding recognition, compensation. Most were denied. The government claimed insufficient evidence, blamed pre-existing conditions, anything to avoid responsibility. Today, most of those soldiers are dead. The survivors are in their 70s and 80s, still fighting for recognition, still being ignored. The truth. These aren't isolated incidents. They're not accidents.